Mic test 1, 2. You love it?
order. I would like to welcome the members, witnesses, and audience to this hearing for the Subcommittee on Oversight and Investigations. I appreciate my colleagues on the dais and the witnesses for being here to discuss the chronic issue of improper recruitment, retention, and relocation incentive payments. These are commonly referred to as the 3 Rs. These incentives are tools provided to the VA by Congress to attract and retain quality staff in positions that are consistently vacant or identified as difficult to fill. While many federal agencies can use these incentive payments, they are particularly helpful for an agency like the VA, whose mission is to provide complex services and quality health care to veterans across the entire country. These incentives are designed to be a part of a benefits package for positions in markets that are difficult to hire in, like specialist physicians, nurses, and social workers in rural areas. Congress gave federal agencies the ability to pay these incentives so that government entities like the Veteran Health Administration can be competitive in attracting and keeping quality healthcare professionals in a labor pool that is facing staffing challenges across the country. As a nurse practitioner, I understand these challenges firsthand. Unfortunately, recent reports have shown that these funds have been proven to be paid out with very little oversight. While this hearing was organized after the release of the June 2025 OIG report on the VA's poor oversight of these incentive payments, the problems we will discuss today are not new to the VA. In fact, in 2017, the OIG released a similar report detailing oversight issues with recruitment, relocation, and retention incentive payments based on the OIG's oversight work stretching back to July 2014. The 2017 OIG report identified the need to improve controls over the use of these incentives, having found that the VA did not properly authorize 33% of the retention incentives that were awarded to senior executives. The improper payments found in 2017 totaled more than $158 million in unsupported spending. As a result, the OIG made recommendations that the VA develop internal controls to monitor policy compliance and decrease the VA's reliance on retention incentives. Now, here we are in July 2025, confronted with the same issues that the VA has failed to improve since the first report. The only difference is that now there is even more taxpayer dollars involved. For example, between 2020 and 2023, relocation payments grew by 85%, and retention payments have grown by 131%, while recruitment bonuses have ballooned by a staggering 237%. I believe anyone would agree that these numbers are alarming when there is little data to back up the massive increases. The 2025 report acknowledged that after the initial report, VA implemented processes to improve authorization and review controls for the payments. However, VA employees inconsistently followed them. This made the good government improvements virtually useless. In response to the 2017 OIG audit, quality assurance teams were created at both the Office of Human Resources and Administration Operations, Security and Preparedness, and the VISN level. However, the 2025 OIG report found that while these teams identified errors, they did not address systemic issues in the request and authorization of incentives, did not proactively prevent incentive packages from being processed and paid based on insufficient justifications. Additionally, the OIG found that 28 employees continued to receive annual retention incentives for many years after the initial award period expired. In one case, an employee continued to receive annual incentive awards for more than 11 years after the initial award period. In total, the VA improperly paid these employees a total of about $4.3 million. Between 2020 and 2023, more than 134,000 employees received incentive payments totaling $1.2 billion. 341 million of those incentives were found by the OIG to be improperly documented. The lack of documentation also hinders review efforts by oversight bodies like the OIG, the GAO, and this committee. I echo what the OIG said in their report, that the required documentation helps provide assurance that incentives are properly used, and effective oversight of incentives also requires sufficient documentation for review. In fact, the OIG noted that much of the data used in the report relied on projections due to the VA's sparse documentation. I found it shocking in the report that when cases of waste, fraud, and abuse were discovered, the VA's implementation of established processes did not always guarantee that the issues were appropriately resolved. The 2025 report cited an example where VHA awarded $30,000 in relocation payments for an employee who never relocated. The employee was a remote worker, teleworking from home. When someone receives a relocation incentive and never actually relocates, that's wrong and a clear waste of taxpayer dollars. Despite this clear case of impropriety, the VHA declined to recoup the payments that were made to this employee. These are taxpayer dollars set aside for veterans, and for far too long they have been carelessly handled. I'm excited to hear the Trump administration's plan to not only satisfy the OIG's recommendations, but their plan to make real and necessary improvements and corrections in how the VA manages and oversees their incentive programs. The status quo is not acceptable, and we will continue to push the VA to make improvements that lead to better care outcomes for the veterans that are receiving VA services. I look forward to working with Secretary Collins and his team to right the ship and create real change at the VA. And I now recognize Ranking Member Ramirez for her opening comments.
Thank you, Chair Kiggins. Today's hearing's topic is critically important. We are examining the use and the oversight of the quote-unquote 3R incentives at VA: recruitment, retention, and relocation bonuses. The so-called 3Rs help VA attract talent. Earlier this month, Secretary Collins celebrated the VA will lose nearly 30,000 employees by the end of the fiscal year. I find that despicable. I want to be clear. Every VA employee is mission critical. Every VA employee ensures veterans get the care and benefits they've earned and deserve. So if we care about veterans' care and services, it is more important than ever that we discuss how the VA keeps employees, as Secretary Collins deconstructs, decimates, and demoralizes the workforce. Veteran care is already being negatively impacted by the destruction of the VA workforce. For instance, we know that doctor appointments for veterans have been canceled due to staffing shortages, and we know this because veterans have told us themselves. So how do we course correct? How do we ensure the VA has the workforce it needs to support the care veterans have earned and deserve? First, we have to ensure that the VA is a place where people feel valued, not disposable, and not attacked. As a former executive director of a nonprofit organization, I know that public sector agencies like the VA and nonprofit organizations cannot compete with the private sector in terms of salary in many places across the country. In tough markets, 3R incentives help make VA offer more competitive wages. They're a tool to attract and retain highly qualified employees to the agency. I understand that this hearing is meant to focus on the VA Inspector General's findings from a report released earlier this summer that the VA needs more oversight of 3R incentives. I do not disagree that the VA must be a good steward of taxpayer dollars and that we must ensure that the correct employees are receiving the correct pay for the correct period of time. No objection, no disagreement there. At the same time, we must ensure that the VA's oversight of the 3R's incentives does not make them a more burdensome and less useful tool for leaders who need them to recruit and to retain staff. We need to hold two objectives at the same time. The process must work and it must allow it to be competitive by working quickly and efficiently. If we do not meet both of these goals, I fear that greater layers of bureaucracy may disincentivize leaders from offering 3R awards. I look forward to hearing from our witnesses today about how we can strike a balance to ensure 3R incentives are being used properly, efficiently, and routinely. I'm going to show a series of posters with data pulled directly from the VA's Workforce Dashboard, published on June 27, 2025. Numbers don't lie. We can see here a sharp decline in both recruitment and retention since Secretary Collins took the helm. The VA has seen an over 45% reduction in job applicants this year compared to last year. VA saw an over 56% reduction in new employees actually starting jobs. The VA lost 4,144 employees in mission-critical occupations as defined by the VA since the beginning of this fiscal year. Compare that to the Biden administration only losing 111 employees in mission-critical occupations during the same period in 2024. And as if losing 4,100 employees in VA-designated mission-critical occupations wasn't bad enough, I want you guys to take a closer look at how many employees Secretary Collins has lost in some key veteran-facing roles. To be clear, these numbers are not net losses. They're net losses, not just normal attrition. The numbers we are looking at account for any new hires. And again, these are positions that are not subject to the hiring freeze and were exempt from the DRP. So what you're seeing is that since the start of this fiscal year, the VA has lost a net of 1,720 registered nurses, 1,147 medical support assistants, 604 physicians, 193 police officers, 77 psychologists, 358 social workers, 1,081 veteran claim examiners, 868 custodial workers. So by its own data, the VA has had over 7,500 employees in veteran-facing roles leave their jobs this fiscal year, and their positions have not been backfilled. So how can Secretary Collins look at us and at veterans with a straight face and say that veterans' care has not been affected by staffing changes when he's lost at least 7,500 veteran-facing employees? The numbers we're looking at and their impact on veteran care is upsetting. And if you're not mad yet, just take a look at our next poster so we can get a sense of why these employees have left the VA. Reasons for leaving, a series of concerns, for example, geographical relocation, desired work schedule not offered, lack of trust and confidence in senior leaders, again, lack of trust and confidence in senior leaders from social workers. Medical and dental are talking about the work schedule offered doesn't work for their ability to serve the veterans. And then you see over and over and over, lack of trust and confidence in senior leaders, lack of trust and confidence in senior leaders. And you also see here from contracting officers unethical behavior on the part of leadership or the organization. That's why medical and dental, general administration, psychologists, social workers, HR specialists, HR assistants, cemetery caretakers, veterans claim exam, processing personnel, contracting officers, and IT specialists are leaving. Any quality leader I know who got this feedback in their exit interview would do some serious self-reflection. But the VA has a failure of leadership crisis, and Secretary Collins is to blame. Secretary Collins accuses us of fear-mongering and lying when we raise the alarm that veteran care is being impacted, but these numbers don't lie. There's just no possible way that VA could lose 7,500 veteran-facing employees without care being impacted. The Secretary could turn the ship around to attract and retain more employees to care for veterans, and the 3R incentives are one of those tools. But he isn't, because he doesn't want to turn the ship around. He's committed to destructive collision course. Let's look at the dashboard even closer. Just take a look at the reduction in the use of PACT Act authorities like recruitment and retention incentives from year 2024 to year 2025. Last year, during the Biden administration, retention incentives were used nearly 20,000 times. This year, under Collins and Trump, only 7,000 times. Recruitment incentives were used 6,000 times in year 2024, but they've barely used them 1,000 times this year. And take a look at this number. Special contribution awards. These are used when a VA employee goes above and beyond the call of duty when caring for veterans. When Biden was president, nearly 30,000 special contribution awards were given to VA employees. Under Collins, barely 7,000 awards have been made. Here's the bottom line. It's not that VA employees are less meritorious than they were under Biden. It's that no matter what the VA employees do, they will never really receive 3R awards because the Trump administration, through Secretary Collins, wants them to leave. They want every employee to be pushed out so they can decimate the VA's workforce and destroy it in order to justify privatizing the VA. Secretary Collins has made VA employees his target, and in doing so has targeted veterans who rely on VA for their care and benefits. So yes, it is more important than ever that we do everything we can to keep VA employees working and caring for our veterans. Secretary Collins' tenure at the VA has been one of torment. For months, VA employees have worried they would lose their jobs and livelihood through a RIF. Now, while Secretary Collins promises that a quote-unquote large-scale RIF is off the table for the time being, we all remain concerned that if he is leaving the door open to eliminate positions through the reorganization and consolidation. And veterans worry that their service and care will be impacted by the changes in the VA workforce. Well, veterans are right. How can we expect to provide high-quality services through a robust, talented workforce under these kind of conditions? But again, the instability, the uncertainty, the volatility is the point. Veterans deserve a VA that they can rely on, and Secretary Collins is undermining the VA and its workforce at every chance he gets. It is why I look forward to our conversation today and hearing from our witnesses, and with that, I yield back.
Thank you, Ranking Member Ramirez. I will now recognize the witnesses testifying before us today. We have Ms. Tracy Thurett, Chief Human Capital Officer, Human Resources and Administration. Welcome back. And Mr. David Perry, Chief Officer, Workforce Management and Consulting, Veterans Health Administration. Mr. Sean Steele, the Director of the Human Capital and Operations Division, Office of Audits and Evaluations of the Office of the Inspector General. And Dr. Sheila Elliott, President for the American Federation of Government Employees, Local 2328. Welcome. So if the witnesses will please stand for me and raise your right hand. Do you solemnly swear that the testimony you are about to provide is the truth, the whole truth, and nothing but the truth? Thank you. You may be seated. Let the record reflect that the witnesses answered in the affirmative. Ms. Thurett, you are now recognized for 5 minutes to provide the VA's testimony.
Good afternoon, Chairwoman Kiggins, Ranking Member Ramirez, and distinguished members of the committee. Thank you for this opportunity to discuss how VA is improving governance and oversight of recruitment, relocation, and retention 3R incentive payment practices. As pay caps for healthcare professionals at VA have not kept pace with rising salaries for healthcare professionals and specialists, the 3R program is a critical component of VA's incentive plan. I am joined today by Mr. David Perry, Acting Chief Human Capital Management, Veterans Health Administration. VA will always fulfill its duty to provide veterans, families, caregivers, and survivors with the health care and benefits that they have earned. To ensure all veterans and VA beneficiaries continue to receive their earned benefits and services, VA is always recruiting dedicated professionals. As of July 2025, more than 350,000 critical positions are exempt from the hiring freeze. While VA has historically offered 3R incentives to address occupational shortages and facilities hiring initiatives, the department must provide greater accountability and stewardship of taxpayer resources by enhancing our procedures, documenting requirements, and providing oversight of these incentives. Starting in 2017, VA updated department policy on 3R incentives to establish internal controls and provide oversight. Specifically, VA began requiring annual certification of the incentive that it was appropriate and in compliance with policy, and succession plans to reduce long-term reliance on incentives, and established residency before payment of receipt. In the years since, VA has continued iterating and implementing additional improvements, including the following: requiring a standard form to capture all the required information by law, aligning the use of 3Rs with shortage and hard-to-fill positions, obtaining authorization and justification before including 3R incentives in job announcements, tracking unfulfilled service obligations, improving coordination of debt collection and enforcing debt collection, and reviewing incentives annually and terminating them in a timely manner when they are no longer needed. However, there is always room for improvement, and VA must continue to refine its governance of those incentives, including proper documentation in their use, ensuring correct signatures are in place, ensuring justification in employing 3Rs is sound. VA must develop stronger oversight mechanisms and discontinue the use of multi-year incentives. Finally, VHA is implementing a comprehensive strategy to enhance the management and oversight of the incentives program. It includes continuing to monitor internal control procedures and guidance to ensure 3R documentation is appropriately maintained in accordance with VA policy. VHA will also conduct a program to monitor quarterly and utilize uniform checklists and templates nationwide. VHA is developing training and materials to ensure proper documentation for succession plans, performance ratings, and to strengthen the technical review. VHA is creating oversight plans and a strengthened technical review program to assess every incentive for technical adherence. At an enterprise level, oversight monitoring component will act as a second-level check at the national level. VHA aims to support the compliance with record retention requirements, and furthermore, specific performance metrics will be tied to operational leadership and human resources leadership They're being developed and reinforcing the importance of proper governance and oversight of incentive programs. VA is committed to addressing these issues that have been identified by the Inspector General's report and strengthening the process to support the VA mission. We are confident that the steps that we have taken and will continue to take will strengthen our incentives program and the governance and oversight required, leading to more effective outcomes and better service to veterans. While the 3R incentive program is an important tool for the department in attracting and retaining talent, it is not enough for the VA to remain competitive with industry. VA looks forward to working with the committee on strategies to ensure that VA is an employer of choice for physicians in critical needs specialties. I am proud to be part of the noble mission to care for our nation's veterans. I look forward to working with each of you on the committee to more effectively and efficiently provide enhanced oversight and governance of the incentive payment practices, ensuring VA can continue to provide the best care and services to veterans and their families. I conclude my testimony, and my colleague and I welcome any questions that you may have for us. Thank you.
Thank you, Ms. Thurett. And Mr. Steele, you are now recognized for 5 minutes to provide the VA's OIG's testimony.
Chairwoman Kiggins, Ranking Member Ramirez, and members of the subcommittee, thank you for the opportunity to testify on the OIG's independent oversight of VHA's management of recruitment, relocation, and retention incentives. These incentives are meant to help VA entice candidates to accept hard-to-fill positions or to retain high-quality staff. Our work focused on identifying whether VHA used incentives effectively, complied with the law and VA policy, and acted as strong stewards of taxpayer dollars. As the OIG has documented, VHA faces significant staffing shortages in key positions, also known as critical need occupations. This long-standing challenge affects clinical positions, as well as non-clinical support and security functions. Critical need occupations are often difficult to fill due to the limited number and quality of candidates, unfavorable employment trends, and lack of appeal for the position's duties or geographic location. Our work shows that, despite VHA's ability to hire non-competitively, they continue to experience staffing shortages for positions fundamental to the safe and effective delivery of care to veterans. Other OIG reports highlighted weaknesses in VA's processes and controls governing the use of pay incentives. Our 2017 audit found that VA needed to improve controls over recruitment, relocation, and retention incentives to ensure they were strategically and prudently used. We also reported in May 2024 that VA awarded $10.8 million in critical skill incentives to nearly all VHA and VBA central office executives without required support, showing the employee possessed a high-demand skill or skill that is out of shortage. Over 182 senior executives received payments averaging about $60,000 each. Subsequently, over 90% of those funds had been recouped. We closed the recommendations for both the 2017 and 2024 reports because VA provided sufficient evidence to show action had been taken to implement needed changes. However, the OIG continued to monitor VA's use of these important staffing tools. Last month, we published a report that evaluated VA's controls over and governance of recruitment, relocation, and retention incentives. It focused on awards paid to VHA employees from fiscal years 2020 through 2023 and tested many of VA's actions taken in response to the 2017 OIG report. Overall, we found that VA used incentives extensively to address critical staffing needs. In fiscal years 22 and 23, nearly 90% of incentives went to employees in occupations on staffing shortage lists. However, VA did not effectively govern the process to ensure that VHA officials consistently captured information required to support the awards. Key forms were missing or lacked sufficient justifications and approval signatures. This information helps confirm incentives are properly used and is needed to carry out effective oversight. Consequently, we found that VA's prior corrective actions to implement our 2017 report recommendations were not sustained as policies were not routinely followed. Overall, we estimated that the award justification could not be verified or is insufficient for 30% of VHA employees that received incentive payments. This amounted to about $341 million in incentives that were not adequately supported. Our team also found 28 VHA employees who received retention incentive payments long after their award period had expired. These individuals were improperly paid for an additional 8 years on average, totaling about $4.6 million. In conclusion, the OIG's oversight work has highlighted VHA's ongoing challenges with addressing severe occupational shortages in essential positions. Our reports have also shown that attempts to narrow those staffing gaps through recruitment, relocation, and retention incentives do not consistently follow requirements. It is also concerning that these issues are not routinely detected by VA's quality control measures. VHA must emphasize to responsible personnel the importance of following policies and procedures to safeguard against improper payments. OIG teams will continue to monitor VHA's staffing needs and the use of incentive payments. In doing so, VHA will be held accountable for securing qualified personnel to provide high-quality care to veterans while making the most effective use of taxpayer dollars. Chairwoman Kiggins, this concludes my statement. I would be happy to answer any questions you or members of the subcommittee may have.
Thank you, Mr. Steele. Dr. Elliott, you are now recognized for 5 minutes to provide your testimony.
with the Recruitment, Retention, and Relocation Bonus Program and beyond. On June 12, 2025, the OIG released a report on the Recruitment, Relocation, and Retention Incentives Bonus Program. The OIG highlighted several problems with the administration and oversight of the program that AFGE agrees with. Chief among the problems identified is the failure of VA human resources. While VA did use this tool to recruit and retain clinicians, there were problems in how the bonus program was managed. AFGE has previously criticized the HR modernization that the OIG is citing here, agreeing with the conclusion that it has led to increased turnover at the VA. Additionally, AFGE believes that HR not being in the facilities and lacking familiarity with the workforce and the veterans they serve increases their turnover. This undermines the ability of HR to serve employees as well as administer the bonus program. In preparation for this hearing, when contacting the Hampton VA, we could find no repository of data to show who has received these bonuses. However, after reaching out directly to 800 bargaining unit members at our hospital, AFGE had 9 bargaining unit members who reported that there were 4 recruitment bonuses, 4 retention bonus, and 1 relocation bonus awarded between 2021 and 2025. While AFGE is pleased that at least 9 employees received these bonuses, we have no way of knowing if this benefit is properly utilized compared to the rest of VA. Regardless, I can say with decades of experience at this facility that there is significant room for improvement, both at the hospital and the brand new North Battlefield Outpatient Clinic, which opened this year, 27% staffed. We urge the VA to use these bonuses and other tools to increase capacity at the clinic and the hospital. Beyond the bonus program, AFGE has other suggestions to improve recruitment and retention. As the committee is aware, in March, President Trump signed an executive order eliminating the collective bargaining rights of 1.5 million federal employees at agencies, including VA. Continuing to deny large swaths of the VA workforce collective bargaining rights will continue to harm recruitment and retention. As there is a critical shortage of clinicians in this country, Many quality candidates who want to serve the VA may avoid the agency to receive both union protections and better salaries in the private sector. This is particularly egregious as Secretary Collins played favorites when choosing whom to exempt from the executive order, not by job description or duties, but by which union represents the employee in question. AFGE members lost their collective bargaining rights despite having identical jobs to employees who were exempted and retained their rights. AFGE urges members of this committee to support H.R. 2550, the Protect America's Workforce Act, which would nullify this illegal executive order. AFGE has long argued for the benefits of telework for employees who can perform their duties remotely. This is particularly true for clinicians who practice in whole or in large part through telemedicine. However, since most telework has been rescinded by this administration, many clinicians have had to report to a VA facility and then have been required to interact with patients remotely, often in crowded bullpens discussing private matters. This has harmed morale and retention of mission-critical and hard-to-recruit clinicians at the VA. This has negatively affected retention at Hampton and reflects VA's overly broad approach to telework and telehealth. I hope that my testimony today leads this subcommittee to help improve recruitment and retention at the VA. Thank you, and I look forward to answering your questions.
Thank you, Dr. Elliott. We will now proceed with questions. However, before I do that, I would like to make sure the record is clear regarding not just mental health services that are offered at the Hampton VA. We've pushed and will continue to push for veterans to receive the care where we need it. That's why I've advocated for additional facilities in my district that provide these services. And in addition, and more specifically, that North Battlefield VA clinic in Chesapeake, I wanted to clarify and echo Secretary Collins' words about that facility. It's opening in deliberate phases to ensure safe, effective, and high-quality care as services and staffing scale up responsibly. While some public comments have mischaracterized this phase rollout, the facts are clear. The clinic opened in April 2025. I was at the ribbon cutting with 150 staff and core services, including primary care, mental health, and pharmacy. To quote Dr. Elliott, that was 27%, and it was always intended to expand in waves. In July, dental and additional mental health services came online, and by January 2026, the facility is scheduled to be fully operational with radiology, optometry, telehealth, and more. This is a standard and prudent approach for bringing a major healthcare facility online. As we grow more patients, we grow more staff. Spreading misinformation about staffing levels or service delays only undermines the hard work being done to provide the best possible care to our veterans. I remain committed to ensuring this facility and all our VA healthcare facilities reach full potential and deliver the timely, high-quality care the veterans in Chesapeake and across Hampton Roads have earned. In conclusion, and for clarification additionally from Secretary Collins, I'm pleased the Department of the VA is not going to pursue a large-scale reduction of force and have been reassured that any early retirements will come from redundant positions and non-essential personnel. This will safeguard operations at the VA and thus ensure services to our veterans. I'm confident that Secretary Collins will prioritize maintaining a robust healthcare workforce at the VA to ensure veteran care and benefits are not impacted. We can all agree that giving our veterans the care they need is essential. Under President Trump, I know that our veterans will be put first. In fact, the VA's performance has continued to improve under his leadership, with disability claim backlog already down nearly 30%. The work Secretary Collins is doing to modernize the VA's operations and get our veterans the quality of care they need is a breath of fresh air. By June, the VA had already processed 2 million disability claims, accelerated the implementation of the integrated electronic health record system, and made it easier for survivors to get benefits. These accomplishments on behalf of our veterans deserve recognition. And with that, I have questions, and my first question will be for Ms. Thurett. Ms. Thurett, the OIG found that the VISN quality assurance teams conducted reviews after the incentives were awarded. Can you explain why the VA's review process appears to be reactive instead of proactive?
Chairwoman Kiggins, regarding the VISN's review process, I'm going to ask Mr. Perry to respond to that question.
That's fine.
Thank you, Chairman, for that question. We agree where the VISN is needed to do a more proactive approach. We are shifting that responsibility over to the compensation aspect of the VISN to do that on the front end versus the back end. So we recognize that that is a gap in our process that we're making a modification adjustment to now.
And will the VISNs be talking to each other then to come up with a more standard approach?
Yes, overall, we are taking that approach to look at standardization. I think what we saw back in 2017, where it was down at the facility level, we had about 150 ways of doing it. We have made improvements, that is 18, but we do have some areas to improve to make sure that the 18 are doing it consistently according to policy.
That'd be great. Consistency would be helpful. And I go back to Ms. Thurritt, but either Ms. Thurritt or Mr. Perry, would you please explain step by step how one of these 3 incentive payments would be approved, starting with the first step to the actual payment to the employee?
So Chairwoman Kiggins, I appreciate the work of the Office of the Inspector General because their very detailed, actionable reporting helps us to improve. And we made improvements from the 2017 report and will continue to make improvements based on the 2025 report. So recruitment and relocation incentives are one category of 3 Rs. The recruitment incentive is to attract individuals into the federal government. The relocation incentive is to help move employees into locations that are hard to fill or where there's a specific need. There is a standard form 10016 that is completed for both of those incentives. One of the deficiencies in 2017 that we rectified in 2025 was that our department policy and procedures did not align with regulation. So now we have a department-wide policy, everybody should follow it consistently, and we have standard forms that every supervisor who's recommending an incentive, every HR official who's reviewing an incentive, and every approving official would utilize. So that's for the recruitment and relocation process. We have a similar 10017 that's used for retention. Retention incentives are typically shorter term. Recruitment and relocation can be up to a 4-year service obligation. Retention incentives, we typically look at a 1-year retention incentive service period. And the reason being, for retention purposes, we're looking at somebody who's likely to leave federal service and has a unique skill that we can't afford to walk out the door. And we need a short period of time to put that succession plan in place to either develop someone with those skills to step in when they depart or to be able to recruit somebody before they leave. So that's the process and the steps from someone recommending an incentive for an individual under one of those 3 sets of parameters to then HR reviewing the requirements based on regulation, and then for the approving official to sign off on it. Once the individual is identified, then they too have responsibilities. Signing the service obligation, making sure that they relocate if it is a relocation incentive, making sure they are new to the federal service if it's a recruitment incentive. And for retention incentives, we have a 1-year hard stop where supervisors need to review and recertify that that is still needed. Otherwise, it will be terminated automatically. So those are just some of the steps that we take with recruitment, relocation, and retention incentives, some of the things that we have in place, and where the IG has identified more steps that we need to take to have better oversight and compliance, that we are willing and currently in the process of doing that.
And that approving official, who is in their next step in the chain of command? Who would they report to?
Yep. So Chairwoman Kiggins, we have delegations of authority for our 3 Rs incentives. Typically in the Veterans Health Administration, which is the subject matter of the report, a recommending official would be a medical center director. Approving official could be up to a network director. It depends on the percentages of the incentives that are being offered. Sometimes it's higher, but that's typically how the delegations of authority flow. Now, we also have breach of agreement procedures that we follow to make sure that if somebody does not fulfill their obligation, that we are going back and initiating and collecting those debts. Again, these are taxpayer dollars. We don't want to see these incentives misused or abused. I know there were instances in the report that were identified. We don't want that to continue to happen. The breach process is the individual employee who's asking for a waiver of repayment will go to their supervisor. That supervisor will take it the whole way up the chain of command to the Undersecretary of Health and the Veterans Health Administration. If they approve that request to waive payment, then it comes to my office, and our Assistant Secretary for Human Resources and Administration, Operations, Security, and Preparedness would be responsible for that process. So that's just an example of the levels at which these are reviewed and the seriousness with which we take things like breach of agreements.
Thank you for that very thorough explanation. How long has that exact chain that you just described been in place? Is that new this year in 2025?
So I would say it dates back to 2020 when we revised our departmental policy. And we do have statistics if the committee is interested in terms of how many cases go through that process, the percentage that reach my office. It's a small percentage, maybe 1 a month. and a very low percentage that is approved because the standard for waiving a breach of a service obligation is very high. It has to be, it's stipulated in law as repayment would be against equity and good conscience or not in the best interest of the government. And when we are paying individuals and they are not upholding their end of the agreement, that is something that we want to pursue.
Yeah, that too. Thank you. My time has expired. I'm sure that we will have a second round of questioning, but I will yield to our ranking member.
Thank you, Chairwoman. Dr. Elliott, I want to first thank you for being here and taking time away from your day job as a pharmacist at the Hampton VA Medical Center. I understand you're also the caregiver of your mother. Is that correct? Yeah. Well, you're a superwoman, and I'm really grateful for your participation and your continued dedication to your VA brothers and sisters at the AFGE. You mentioned in your testimony that there's a lack of clarity in how and when 3R incentives are used at your facility in Hampton. Do you think that if 3R incentives were made widely and frequently used at Hampton, the facility would be able to onboard and keep more employees?
We used to have a process whereby we had hard-to-recruit and hard-to-fill positions at our facility. I do not know where that process is at this time. I have not heard anything of it for the last several years now, especially since we've been decentralized with respect to the HR staff. But that is supposed to be the, those people on that list are supposed to be the designees of various recruitment, retention, bonuses, and so forth. In my 35 years there, I've never seen a relocation bonus for a line staff person, no matter what their job was. Typically, those have been reserved for top management, the various relocation bonuses.
Yeah. And Dr. Elliott, I wanted to ask you if you had any reactions to how the Secretary is characterizing staffing at North Battlefield Clinic, since you're on the ground actually working there.
And I can tell you this from the standpoint of a veteran. I go to, this is what the veteran said during a panel. I go to the VA at North Battlefield, have my primary care appointment. However, if I want to receive other services, such as x-ray and those sorts of things, I still have to drive to Hampton. That's problematic.
That is. Well, thank you, Dr. Elliott. I want to now turn it over to Ms. Sterritt. Ms. Sterritt, how many employees has VA lost through quote-unquote natural attrition since January of this year?
Ranking Member Ramirez, we do look at that data on a regular basis. I believe the last statistics that I saw of all of the separations, those are voluntary and involuntary actions, about 20,000 that have occurred over the last few months.
20,000 over the last few months. Is that what you just said?
Over the last few months since the beginning of the year.
I just wanted to make sure I had heard correctly. And how many of those employees are in veteran-facing roles like direct care or benefits counseling? What would you say?
Ranking Member Ramirez, the number that I cited was at the aggregate level, so I'd have to go back and break that down to look more specifically at direct care positions.
Ms. Sterritt, if you could go ahead and follow up on that, I would really appreciate it. And the follow-up question I have to that is if you know if those positions were backfilled.
So Ranking Member Ramirez, as I mentioned, about 350 positions are exempt from the hiring freeze. I do see data on a bi-weekly basis of the job announcements that are posted and the individuals that we are bringing on board. I know we're bringing several thousand a pay period back into the VA. I know that statistic is actually reported on the workforce dashboard each month as well.
Got it. So Ms. Sterritt, when you follow up, if you can try to get me a little bit more detail, that would be really helpful. I want to go back to these posters. On the VA Workforce Dashboard dated June 28th, 2024, so last year, there's a note at the very top that says top risk, and then reads, quote, delays or termination in use of PACT Act Title IX authorities will have a negative impact on recruitment and retention, end quote. Now, those PACT Act authorities referenced here included recruitment and retention incentives, among other bonuses. Is that correct, Ms. Sterritt?
Yes, it is, ma'am.
Why has there been such a stark downward trend in the use of 3R incentives from year 2024 to year 2025?
So as mentioned earlier, there has to be a justification for using a recruitment or a retention incentive. In many situations, I know Dr. Elliott mentioned our hard to fill and our shortage occupations, and I think Mr. Steele has mentioned it as well, that we are able to post those job announcements, get qualified candidates, and bring them on without using an incentive.
So, Ms. Therrett, this is my last question for this round, and we'll come back to the second round. But is a delay or termination of using these authorities having a negative impact on recruitment and retention at the VA?
At this moment in time, we are able to post and fill those positions that are being vacated in our direct care positions.
So you are not noticing just yet the negative impact on recruitment and retention of the VA? Is that what you're saying?
Correct, ma'am.
Thank you. With that, I yield back.
Thank you. The chair now recognizes Mr. Conaway for 5 minutes.
Thank you, Madam Chair. And I guess before I ask my questions, I can't help but put some more clothes, if you will, on the statements of our ranking member. When you hear about the intention, the leaked intention of the number of employees that the Secretary intends to cut from the VA, it's hard to imagine that anyone who might think about entering a career in public service and working at the VA would look upon the VA as a place to land and to work and to engage in public service, taking care of our valuable and hopefully appreciated veterans. This kind of announcement from the top can't help but hurt the effort to retain frontline healthcare professionals and others who are so critical to the operation of that facility. People, obviously need nurses, you need doctors, but you also need someone to make sure that people get food delivered to them. You need to make sure that you've got a pharmacy that's working. You need to make sure that the cleaning services are working and that the building and the facility is secure. And you need people to do all of those jobs and to want to come to work and have that work appreciated. And it's hard for us on this side of the aisle to hear and to understand these obvious dynamics with respect to their union rights and their prospects for a career that is both satisfying, rewarding, and appreciated by their government, by their employees, that's not going to have a profound impact on the ability of the VA to do its work and to honor our commitment to veterans, and that it's not part of a grand plan, as Ranking Member has pointed out, to privatize these services. And we are seeing this across at least the signs of this, and I think very definite pattern across the federal workforce and the federal government. I'm a physician myself. I've worked, I've trained at a VA facility for part of my training. I served on a military base as a physician there, and I certainly treated a lot of veterans, even in private practice, after leaving the service, because of where my district is a home of a military base, a joint base McGuire, and so we have a lot of veterans who live in that area and were patients of mine. And I understand how important the VA is to them and their ability to use the VA when they need it for their care. I'm disturbed to hear about what's happening with the physician workforce, the losses there, and particularly the ability of psychologists and psychiatrists to treat patients because of the attack on remote work. Just because someone's being seen remotely doesn't mean that anything that's said in the interactions between the physician and someone who is receiving their care remotely shouldn't be protected. Their privacy shouldn't be protected there. And when you consider people now being put in cubicles or putting in spaces where their conversations are not secure and private, that impacts the kind of care that they wish to give, and how they ought to practice that life-saving care. As we know, there's so many dislocations with mental health in the service. So, and I understand, Ms. Elliott, Dr. Elliott, pardon me, that you have an example of a change in this retention policy and the loss of remote work. Can you comment on the impact of that situation at the Hampton VA?
Thank you. At our facility, we have a 43% lack of our recruitment is 43% behind, meaning that out of 100 positions, 43 of them are vacant. We are in the process now of losing a psychologist to another facility because that particular psychologist lived far away and could not come to Hampton with no relocation bonus offered. That psychologist was able to get a relocation bonus from someplace else, and that's where that psychologist is going. So I guess instead of being 43% behind the 8 ball, we are 44% in a couple of weeks when that psychologist leaves. Now, to add insult to injury there, even though we know that psychologist is leaving, we do not begin recruitment until after the psychologist is gone. Therefore, all of that psychologist's work is borne by someone else, or patients are rescheduled and rescheduled and rescheduled until someone comes in to fill that post.
Thank you, Madam Chair. You'll back a seat. It's my time.
Thank you. I have a couple of other questions. Dr. Elliott, just for clarification, that psychologist I'm sorry. Oh, Mr. Kennedy, let's start with, sorry. Mr. Kennedy, we'll recognize you for 5 minutes first.
Thank you very much. Thank you all for being here today. I have some deep concerns about what's transpiring at the VA across this country. And I know veterans, not only in my district, but across the nation, are disturbed about the news that is continuing to come out of the VA that will impact their care. Just to take a quick trip down memory lane, back in February, the VA dismissed 1,000 employees outright. That was February 13th. 11 days later, on February 24th, the VA cut another 1,400 employees. 2,400 people cut from serving our veterans in this nation. It was the beginning of a despicable pattern that we've seen coming out of this administration. In March, this committee discovered through a leaked memo that the VA planned to cut more than 80,000 employees, which Secretary Collins then confirmed. And now we're being told that the VA will not make this cut, but would reduce the number of employees by nearly 30,000 by the end of the fiscal year. 17,000 already gone, meaning there's going to be another 12,000, more than 12,000 additional cuts, the largest in VA history. And these reductions will affect critical frontline staff, including healthcare workers and benefits personnel. But I recall what Secretary Collins told this committee in May, and I'm going to quote the Secretary. The VA's staffing structure is aimed at finding ways to improve care and benefits for veterans without cutting care and benefits for veterans, and we're going to maintain the VA's mission-essential jobs like doctors, nurses, and claims processors while phasing out non-mission essential roles. That is not what we're seeing. I want to believe that that would be true, but if it's not true, then this committee responsible for VA oversight has been misled. And I have a couple of questions. Ms. Therrett, you visited multiple VA facilities and have spoken with a wide range of employees. Based on what you've seen, similar roles face similar challenges nationwide. So why were collective bargaining rights preserved for nurses and facility workers at the Milwaukee VA, but stripped from their counterparts in the community that I represent in Buffalo, despite nearly identical job functions?
So Representative Kennedy, the executive order related to labor relations is currently under litigation. There is a stay related to that executive order, so we are complying with that litigation right now.
Okay, so no answer. The only clear difference that I can see is union affiliation. Buffalo workers are represented by unions that have filed lawsuits against this administration, unlike those in Milwaukee. That raises serious concerns about political retribution and retaliation. Can you explain at all these decisions, how they were made, and whether the union activity played a role?
Representative Kennedy, I'm, at this point in time, based on the stay in that particular case, I can't answer that question.
Okay, no answer again. Thank you. Dr. Elliott, after having conversations with VA employees in Buffalo, two things are clear to me. They take deep pride in serving our veterans, and they rely on their union to protect their rights and help them provide the best possible care. As you know, President Trump's EO 14251 misused the national security exemption in Title V to remove employees, including those at Hampton VA and Buffalo, from the bargaining unit. You just mentioned in your testimony that 43% reduction in hiring, that you're behind. Based on your experience, has the VA's approach to collective bargaining helped or hurt your ability to attract and retain staff?
I would say that it has. We have been, I guess.
It has.
It has reduced our ability to recruit and retain. It has. But I also would like to say, if you don't mind, this situation about the 30,000 employees that are targeted as far as a number goes. In 1989, I met a nurse named Miss Eddie Ricks. She told me that a failure to plan is a plan to fail. You probably have heard that. When you rely on random reductions, there can be danger there. You don't know which critical and which non-critical position is going to be reduced. So let's say, for example, if out of that 30,000, 10,000 of them are doctors, we can't tolerate that. Or if 15,000 of them are nurses, we can't.
Gentleman's time has expired. We're going to move into a second round of questioning, and we will do 2 minutes for an additional round of questioning. Ms. Thurett, do you anticipate the VHA will develop the necessary guidance regarding quality control checks by the OIG's recommended completion date in September?
Chairwoman Kagans, I do, and I know Mr. Perry has additional information on that.
Thank you. Can you please tell us how VISN leadership will be involved in monitoring the 95% compliance rate?
Yes, Chairwoman. As I previously stated, we are working now on shifting the responsibility of the oversight to the compensation side of the VISN to hold that accountability line to make sure that the proper documentation, technical review, and approvals are in place. So that will be done by the end of this year.
And how long do you anticipate it will take for the majority of VISNs to meet that 95% target?
We've already started that now, and that includes my team rolling out the additional training and oversight to ensure that they do come into compliance by the end of this fiscal year.
Okay, thank you. And Ms. Thurett, do VHA officials have the authorization to approve exceptions to the limitations placed on incentive payments?
VHA officials, through the delegation of authority, are able to approve incentives up to a certain threshold, and then those, depending on the incentive, may have to come up to the Office of the Secretary, depending on the position.
Who is responsible for approving the exception, and who provides a check on this person?
My office conducts an oversight review of those incentives and would also be able to work with Mr. Perry's team to make sure that they are following policy and proper procedures.
And in your experience, are those exceptions more frequently approved for administrative positions or clinical positions?
Chairwoman Kagans, they are more frequently approved for clinical positions.
Thank you. And Mr. Steele, I was shocked to hear that the VHA could not provide OIG evidence for recertification for those recurring incentive payments. Do you believe this is an issue with HR SMART or a result of inadequate oversight by the HR servicing teams?
We saw a breakdown of both systems and people. HR SMART lacked the automation to halt the process if certain requirements were not met. In that situation, it does put more onus on people to enter data correctly and conduct back-end oversight to ensure that the process ceases when it should.
Thank you. My 2 minutes have expired. I yield to the ranking member.
Thank you, Chair. Ms. Thurett, I want to follow up again with you. The 8 Corner staff have been meeting routinely with Mark Engelbaum, the Assistant Secretary for HR, and our staff has requested a detailed breakdown of data on employees who have left the VA since January through the DRP, VERA, or natural attrition. Unfortunately, the numbers that VA provided as a follow-up fall woefully below the level of detail requested. Are you able to produce by location, occupation, detailed data on the number of employees who have taken the DRP, who've taken Vera, who've resigned, who've retired? Are you able to get that information for us?
Ranking Member Ramirez, yes, I can get that
Great.
information.
What about the number of job offers that have been declined by applicants since January of this year? Is that a data point that you have the capability of pulling?
So Ranking Member Ramirez, our talent acquisition system is USA Staffing, and it does capture some information on declinations, but it may not provide the detailed information that you're
Okay,
seeking.
so please provide me everything that in fact is being collected. And Ms. Starrett, can you please commit to working with us on providing the detailed data in a reasonable time?
Ranking Member
Yes.
Ramirez, I welcome the opportunity to work with this.
Great, thank you, Ms. Starrett. I don't imagine you will have this number on top of your head, because I'm sure there's a lot going on and a lot of information you have to try to memorize for these hearings. But I want to bring to you an answer. I want you to bring an answer back for the record. How many veteran care appointments at the VA have been canceled since January of this year due to staffing shortages? If you have the answer, I'll take it now. If not,
Ranking Member Ramirez, I do not. I don't know if Mr. Perry does.
do you have that? No?
We do not, but we can
If
take
you can
that.
come back with it, I would really appreciate knowing how many veteran appointments have been canceled. I'm going to leave it at that, Mr. Steele. I really wanted to ask you a question, but I'm hopeful others can. Thank you.
The chair now recognizes Mr. Conaway for 2 minutes.
I thought we were changing the order, Madam Chair. Thank you for recognizing me, Madam Chair. Just before I get to one of my questions, I just want to make a comment about H.R. 1, the big cruel bill, as I call it. I'm very concerned that medical students going to medical school, very expensive process, that there's now a cap on those loans that students may give, and it's going to particularly be a problem for those students who don't come from wealthy families, where they're going to have to try to figure out how to make up that gap. What do you think that this issue of cutting support for medical education, how do you think that's going to impact the VA? You've trained most of the physicians in the country.
So, Dr. Conway, I would say that when we talk about 3 Rs, there are also other incentives, and you speak to scholarship programs, debt reduction programs, and if you look at the job opportunity announcements that are posted for the VA, many of our Veterans Health Administration job opportunity announcement include those benefits. And I'll ask Mr. Perry
I'm going to reclaim my time because I want to get another question in. Pardon me for that, but I must push on. In 2024, the VA reported a loss of 608 physicians. So just a series of questions. You may not have them, but I want to get them in before my time is up. How many job postings does the VA currently have for physicians? Do you know by chance? If you don't know off the top of your head, I'll just leave them for the record. How many physicians has the VA onboarded in the past month? What is the VA doing to attract and retain physicians? And why do you think we're seeing such a loss in physicians? And I'll leave it at that. If you have questions to any of those, I see my time is up, but I'll look forward to your answer offline.
We're
The
happy to get
gentleman's
those.
time has expired. The
Thank you,
chair now
Madam Chair.
recognizes Mr. Kennedy for 2 minutes.
Thank you. I want to just go back to the secretary and what he said to this committee in May, that the VA would maintain mission essential jobs like doctors, nurses, and claims processors. According to the VA's monthly workforce dashboard, estimated losses for fiscal year 25 are 1,720 registered nurses, 604 physicians, and 1,081 veteran claim examiners. These are mission-critical roles, which run directly against Secretary Collins' points that current and future cuts to the VA won't impact the delivery of care and benefits. As an occupational therapist, I've seen firsthand on the ground what happens when healthcare facilities are short-staffed and that healthcare is not provided to individuals. Right now, our veterans are being provided care by American heroes on the ground in these facilities, but you know what? They're exhausted, and not because they don't care, but because they ultimately are having a trouble keeping up because they're getting cut in staffing. So when that happens in our VA, it's our veterans that are paying the price. And so even though we've been told mission critical employees aren't being cut, evidence on paper is that, in fact, there's a different story. We have credibility issues at the VA and with this administration happening right now. These cuts are impacting veteran care, and veterans should not have to wait longer or see fewer specialists or receive delayed benefits. As members of this committee, we have a sacred responsibility to uphold this nation's promise to our veterans. These cuts are not only short-sighted,
The gentleman's
they're
time has
un-American.
expired.
I yield back.
Mr. Steele and Dr. Elliott, thank you to each of you for coming to testify today. The solution is not just identifying weak policies, but following through with the guardrails that ensure effective oversight. It is clear more attention needs to be focused on ensuring the VA is following Congress's intention when paying these incentives. The fact that we are still having a conversation on this issue after more than a decade since the OIG's 2017 report on improper bonus payments indicates we must do something different. It does not take a rocket scientist to figure out that providing quality and safe patient care is a better use of tax dollars than accounting mistakes. These bonuses, when used correctly, enable the VA to pay attractive salaries to valuable clinical staff and other VA employees who serve our veterans. These incentive payments should go to staff dedicated to providing world-class care for our veterans. When the VA cannot retain its good employees or recruit talented staff, patient care is the first to suffer. I've seen this firsthand as a nurse practitioner. I will not allow that to happen while I am chairwoman of the subcommittee. I'm encouraged that OIG identified better documentation as a means of improving the bonus payment processes as well. Aside from the waste stemming from the improper payments, it is not possible to conduct a thorough review of where processes went wrong when there is no paper trail. That's why I was happy to vote with my House colleagues yesterday for Senate Bill 423, the Protecting Regular Order for Veterans, or PRO Act. This bipartisan bill would provide additional guardrails on incentive payments paid to members of the Senior Executive Service, and I hope the VA will take them seriously. I'm looking forward to further collaboration with Secretary Collins and the Trump administration to assist with our oversight efforts, and I'm grateful for the clarity that today's testimony offers. Ranking Member Ramirez, do you have any closing remarks?
Thank you, Chairwoman. World-class care can't be achieved when you've lost 1,720 registered nurses. Can't be achieved when 1,147 medical support assistant staff leave, or 604 physicians leave, and when asked why they're leaving, they say lack of trust and confidence in senior leaders. The information contained in VA's workforce dashboard is critical to our oversight and to showing the public the true picture of what is happening at the VA under Secretary Collins. It is hard to call us liars and say our claims are a hoax when we have the data from VA to back up concerns that veteran care and benefits are being impacted under Collins' leadership. The information for the public that is listening can be accessed at va.gov/employee/workforce-dashboard. I urge everyone watching this hearing to go now and review the data and make a judgment for yourself on how this administration's actions have and will continue to impact world-class care for our veterans. We know that this administration has a history of deleting or hiding files and tampering with information they don't agree with. So to ensure that these documents remain a part of the public record and are not deleted, removed, or hidden, I request unanimous consent to enter issues 1 through 26 of VA's workforce dashboard into the record.
Without objection, so ordered.
Thank you, Chairwoman, and with that, I yield back.
Thank you, Ranking Member, and thank you all for being here today. Ms. Thurett, Mr. Perry, Mr. Steele, Dr. Elliott, I know you all took time out of your busy schedules, and I appreciate that. I'm sure you were prepared to discuss the real issues at the VA, including the title of our subcommittee, which, just as a reminder, was Counting the Money, Preventing Fraud and Abuse in the VA's Bonus Payment Practices for VA Employees. I appreciate your insight on the issue, why we called this hearing today. As a Navy veteran and a nurse practitioner, I know how critical it is for the VA to provide consistent, high-quality care to those who have served. I'm married to a veteran. I'm the mom to future veterans. I represent tens of thousands of veterans. My own parents are veterans. So it is an issue near and dear to my heart and to my district. I'm encouraged that the VA has decided against large-scale layoffs and is instead taking a more thoughtful and measured approach to improving operations. I also worked at the VA for several years, or for several months as a nurse practitioner. It was a short time because I'm a geriatric nurse practitioner and couldn't utilize my geriatric skill base as much as I wanted to. But I remember that there were a lot of really good people doing really hard work, the physicians, the doctors and nurses, the pharmacists, the allied health professionals, the people who were in one building taking care of people who walked through our front door. I also remember on my lunch break, I would take walks and see buildings full of other people that didn't provide patient care. I didn't know what they did, but I knew where I was called to work and where I was able to touch patients and to impact lives of veterans. So I think there is room, just as this was before my time in politics, just looking at what that facility looked like, knowing that there was room to probably downscale. I want to make sure that our best resources are going to the patient care. But reducing 30,000 positions through attrition rather than eliminating critical roles is a more reasonable path forward, and I know that's what the Secretary is focused on doing. I support efforts to streamline the department, and I give more decision-making authority to local medical center directors who are closest to the veterans they serve. Decentralizing operations can help VA facilities respond more quickly to local needs and improve overall outcomes for patients. At the same time, I'm closely monitoring how these changes may impact support staff who play a critical role in ensuring providers can focus on delivering care. I believe restructuring can be positive, but only if it's done transparently, with input from frontline workers and full oversight from Congress. The lack of clarity around some of the VA's reorganization efforts is concerning, and I will continue to push for more communication and accountability. Congress must be a partner in the process, not an afterthought, and the VA leadership must work collaboratively to keep veterans and employees informed. I will continue advocating for investments in VA services that prioritize patient care, benefits, delivery, and support for the dedicated workforce. Ultimately, this is not a partisan issue. This is about keeping our promises to those who've worn the uniform. Veterans deserve a VA that serves them efficiently, compassionately, and without disruption. Again, thank you all for being here today. I ask unanimous consent that all members shall have 5 legislative days in which to revise and extend their remarks and include any extraneous material. Hearing no objection, so ordered. This hearing is now adjourned.